So Dr. Valentin Fuster, who is the president of the American Heart Association, said back in 1998, which was also the year that nitric oxide won the Nobel Prize in Physiology, but she said the discovery of nitric oxide and its function is one of the most important in the history of cardiovascular medicine. Welcome, everybody. My name is Brendan Burmeyer. I'm a functional medicine practitioner, clinical educator, and researcher, and I'm the clinical education manager for Berkeley Life and the host of The More You Know series. The More You Know is a monthly webcast designed to bring you hot topics and takes on the importance of nitric oxide and blood flow for optimizing the body's natural healing systems. We encourage you to watch, share, and pause the video to take in all of the information. Do you have a topic that you'd like to see us feature? Reach out to us at info@berkeleylife.com. We appreciate you joining us. Now on to the show. Hey, functional friends. Welcome back to the More You Know series. As always, I'm your host, Brendan Vermeyer, the Director of Clinical Operations and Education for Berkeley Life. So today on this episode, we're going to be talking all about the most prototypical classic use of nitric oxide, which is going to be for cardiometabolic care and hypertension or high blood pressure. So let's go ahead and dive in. As I'm sure we can all appreciate, and as we talk about on every episode of the More You Know series, we truly are up against this chronic disease epidemic in the United States, where we see that actually one person dies every 33 seconds from cardiovascular disease. And of course, it's far and ahead the leading cause of death for Americans, costing the United States billions of dollars each year and getting worse year by year. Now, we see that nearly half of American adults have high blood pressure, and about 75% of those with high blood pressure don't really have it effectively under control. This is something that we can have a lot of influence and control of through different lifestyle factors and supplementation, as we'll discuss today. So certainly, I think we all know somebody that is hypertensive or pre-hypertensive and might be taking different types of ACE inhibitors and blood pressure drugs, and of course, costing the United States lots of money every year, as we see down here, this data coming directly from the CDC, with high blood pressure costing about $131 billion each year. And that's averaged over 12 years from 2003 to 2014, and likely worse in 2024. So I think we can all appreciate that suboptimal blood flow is a major cause of chronic disease. Every chronic disease is really characterized by decreased blood flow and perfusion to the organ in question. So this is certainly where we have to recognize that healthy blood flow is really a foundation of wellness, longevity, and healing. So of course, at Berkeley Life, we're really trying to support optimal blood flow by harnessing the healing power of this amazing miracle molecule that is nitric oxide. So as we take a look at nitric oxide in every episode, we like to expand the conversation and look at the infinite clinical application of nitric oxide related therapeutics. And of course, we see that dysregulated nitric oxide is implicated in really all chronic disease. And certainly it can at times get very complex and nuanced. And personally, I love diving into all the literature and digging into that nuance and all the exciting developments that are coming down the research pipelines. So this is, of course, where I like to spend some time on this pathway diagram, this nitric oxide pathway diagram that I created here, that comprehensively illustrates the difference between the more classic, more well-known nitric oxide synthase pathway, as opposed to the nitrate pathway, which is really a pathway that has gone overlooked for way too long. And research in the past 10 to 15 years has really illuminated that this is such a powerful pathway to maintain healthy nitric oxide status and really redox biochemistry at large. So as always, just for a little bit of a recap here in episode 6, we have to recognize that most of our functional medicine clients and patients really might not be benefiting from an L-arginine or L-citrulline based nitric oxide supplement. The reason why being that NOS uncoupling that we talk about in every episode. Of course, you can check out the past episodes if you're not sure what I'm talking about. But that nitric oxide synthase uncoupling can happen when we have elevated oxidative stress and or inflammation, which that's all chronic disease, right? All chronic disease is characterized by elevated oxidative and nitrosative stress, as well as inflammation, lack of cofactors. So if we're lacking in molecular oxygen, maybe they're hypoxic or anemic, maybe they're lacking biotin or BH4, which is a major cofactor for nitric oxide synthase. So a lot of individuals with MTHFR polymorphisms or methylation disturbances or homocystinuria, they'll typically have depleted BH4, or individuals taking methotrexate for autoimmunity or cancer or inflammatory disease, NADPH, FMN, FAD, magnesium, heme, iron, glutathione. If we're lacking cofactors, we have more uncoupling, the oxidative stress, the inflammation, and this is most Americans. So the short and sweet of it that I usually will talk about in various lectures, really the only demographic in my personal professional opinion that could benefit from a arginine or citrulline and cofactor-based product is more going to be young individuals that are in good metabolic health, right? As we age, we lose endothelial function. As we undergo immunosenescence and inflammaging, we develop more NOS uncoupling and impaired endothelial function, especially in andropause and or menopause, when we get a big drop in our sex hormones, especially estrogen, which is a major inducer of endothelial nitric oxide synthase. We'll probably do a future episode all about perimenopause and menopause, because that's a huge area of focus for us these days. Now, we can circumvent a lot of these issues with the NOS uncoupling or the NOS single nucleotide polymorphisms and the dysregulation that can occur over here by leveraging the nitrate pathway and leveraging dietary nitrate or inorganic nitrate supplementation. So certainly, as we'll get into in the subsequent slides, this is why we use our dietary nitric oxide foundation product as our foundational product to boost nitric oxide status, bioavailability, blood flow, endothelial function, and of course, all the other amazing biological effects that nitric oxide exerts, as we talk about in each and every episode as we explore different roles of nitric oxide in the body. So here's that graphical illustration of what I just said in regards to endothelial production declining and becoming more dysfunctional as we age. So by the time we get to about 40 years of age, we typically only have about 50% of endothelial capacity, those endothelial cells that line our vasculature and our lymphatic vessels as well. So there's conversation to be had around lymphatic drainage and vasodilation and nitric oxide. So of course we advocate for a nitrate-rich diet, but as we talk about often, that nitrate concentration in the produce can vary quite a bit depending on where it was grown and soil quality, the region, so on and so forth. So ultimately, we just have to make sure that we test rather than guessing using salivary nitrite test strips in order to assess our salivary level of nitrite as essentially a surrogate marker. We've done extensive research and we see strong correlations with the salivary nitrite levels related to plasma levels of nitrate and nitrite. So today, focusing a little bit on the cardiovascular and cardiometabolic and hypertension piece. Again, the most classic example of what we would really want to be using nitric oxide for. But as I like to argue, I would really say that the clinical application of nitric oxide is pretty infinite. So that's why I love my job so much with Berkeley Life. Now, looking at some of the specific mechanisms of how nitric oxide can promote cardiometabolic health and healthy blood pressure is, of course, by increasing blood flow and supporting endothelial function, supporting oxygenation and nutrient perfusion and delivery, supporting hormone signaling in the cardiometabolic system, acting as a pleiotropic signaling molecule. Nitric oxide also helps to regulate inflammation and oxidative stress in the vasculature, in the endothelium, and also supporting healthy immune function, which can be a major driver of atherosclerosis if dysfunctional, right? We get a lot of neutrophil activation and myeloperoxidase and oxidative damage in the vascular lining, driving inflammation in the endothelium, driving a lot of perturbations within the vasculature that can increase the risk of heart disease. And of course, also maybe another topic for a different episode that we can go deeper into, but we actually see that Nitric oxide helps with glucose disposal and insulin signaling. So there's a lot of benefits when we're talking about diabetes and hyperinsulinemia and hyperglycemia as part of that dysfunctional metabolic milieu, if you will. Now, we also can get better fat burning and energy production from nitric oxide, better mitochondrial function, as well as even supporting the activity in the tone of the vagus nerve, which we've talked about a little bit in previous episodes with the gut-brain axis in general and the vagal pathway. And of course, supporting healthy blood pressure. So Dr. Valentin Fuster, who is the president of the American Heart Association, said back in 1998, which was also the year that nitric oxide won the Nobel Prize in Physiology for the discovery of nitric oxide as essentially a gasotransmitter and a signaling molecule within the cardiometabolic systems. But she said the discovery of nitric oxide and its function is one of the most important in the history of cardiovascular medicine. So certainly very powerful words. Now, this slide maps out exactly what we just talked about with the blood sugar regulation, mitochondrial function, endothelial function. But I want to take a little bit of a closer look at what you might be seeing in your cardiometabolic patients. Of course, many of them might be pre-hypertensive or hypertensive already. They might have cold hands and feet, poor perfusion, maybe they have some degree of neuropathy even, signs of aging, cognitive decline or poor memory recall, maybe brain fog, a lot of chronic fatigue, low energy as well. Maybe even at times you see things like POTS syndrome or tachycardia, or maybe they're just wanting to optimize their overall health in general. So, I like to say that if you have a pulse, nitric oxide is for you. And by supporting optimal nitric oxide signaling, we can really enhance everything else and make everything else work better. So this is where I want to highlight our gold standard clinical trial that we did previously. This is a screenshot of the publication within Clinical Nutrition, and it was the effect of a plant-based bioequivalent inorganic nitrate. So that's referring to our nitric oxide foundation product, and how this affected endothelial function and blood pressure. So we have a link to the study. And of course, this is in your Berkeley Life Direct portal that you can check out as well. But some of the highlights were simply that in this double-blind, placebo-controlled clinical study, we saw an average systolic blood pressure reduction of 12.5 points over 90 days without any diet or lifestyle or medication changes. Now, that's pretty substantial. So certainly you can check out the bullet points here. So there were 67 individuals that were assigned to each group. So placebo controlled, and then of course the nitrate supplementation group. So we actually saw reductions in both systolic and diastolic, while also seeing improvement in endothelial function, as well as seeing a good rise in plasma levels of nitrate and nitrite at all times that were tested. So this was a very, very powerful study that really validates the utility of our product, especially for hypertension and endothelial function. Now, to expand this conversation a little bit further and tie together some of the topics that we've covered on previous episodes, such as episode 1, where we talked about our new prebiotic nitrate gum, or then the oral and gut microbiome and how that plays into this, I want to highlight again that nitrate does have prebiotic-like effects, right? So if you're swallowing a capsule of nitrate, your gastrointestinal microbiome, your gut microbiota, is going to benefit from those nitrates because of those prebiotic-like effects. Now, this is obviously too why we got clever and released a prebiotic nitrate gum. So essentially what we did was we packed the dietary nitrate into a gum matrix. So that way, as your patients and clients are chewing and masticating that gum, their oral microbiota is able to marinate in that prebiotic dietary nitrate. So we're able to increase the diversity and the nitrate reducing capacity of the oral microbiome, which plays such a critical role in nitrate recycling throughout the body. We ingest nitrate. Some of that nitrate can be converted to nitrite or nitric oxide within the oral microbiome, the acidic stomach environment, and the gastrointestinal microbiome. We also have nitrite and nitrate circulating through the blood, and we store a high degree of nitrate in the salivary gland. So then we'll have this nitrate-rich saliva that enters the oral cavity where it's interacting with that oral microbiota, if intact, and is able to be reduced into nitrite. So there's this emerging body of evidence that I'm speaking to here and alluding to that directly shows how oral hygiene directly impacts cardiometabolic health and blood pressure and exercise performance and all of these critical components because of this nitric oxide mediation through the oral microbiome. So especially on this episode in talking about hypertension and high blood pressure, it might not really be intuitive for most patients and consumers out there. For us as practitioners, we need to be caught up on the research and understanding that oral hygiene is a critical component of their overall health. And as functional providers, we can really bring this education to our patients, to our clients, and teaching them how to better care for their oral microbiome, which might also include using the nitrate prebiotic gum to restore their oral microbiota, as well as increase the nitrate reducing capacity of their oral microbiome, right? So this is a powerful way that we're supplying the body with dietary nitrate that can be converted to nitrite and then nitric oxide to support that endothelial function, to support that blood pressure and blood flow and perfusion, while also benefiting their oral microbiome. So these are just some of the species that are nitrate reducers within the oral cavity, such as Haemophilus or Neisseria, Prevotella, so on and so forth. And so this is how this oral microbiome is able to directly impact their blood pressure status. So we have to be thinking about some of our patients and clients' lifestyle habits. Are they smoking or vaping or drinking too much alcohol or using antacids? Are they using chlorhexidine-based mouthwash or fluoride toothpaste? Maybe too many antibiotics, maybe poor nutrition habits, so on and so forth, right? And these are ways that we can work smarter, not harder, in educating our patients. So that way we can optimize their nitric oxide, reduce their blood pressure, improve their cardiometabolic health, so on and so forth. So of course, we always want to make sure that we're teaching our patients how to use the salivary nitrite test strips. We want a healthy level of pink pretty much all day, every day, right? We recommend testing at least once or twice per day, maybe first thing out of bed and then 90 minutes post supplementation to see how much of a pink reaction we get. So these salivary nitrite test strips are measuring nitrite ions in the saliva. So we're also essentially indirectly, or rather arguably directly, testing the ability of their microbiome to convert the nitrate that they took, whether it's in capsules or a salad, so on and so forth, and their ability to convert that nitrate into nitrite within the oral cavity using the salivary nitrite test strips. So again, I recommend more than 2 strips per day. I like to test 3, 4, 5 times. I like to test in the morning, 90 minutes post supplementation, pre-workout, post-workout, before bed. Some days I do less, some days I do more. That's just me, but I like to test, not guess. I want to optimize my nitric oxide and blood flow all day, every day. So that's how I choose to go about it. So this is our total nitric oxide solution system, and it all starts with the test strips, and then we can build our nitrate reservoir or our nitrate pool. So that way we always have adequate circulating nitrate that we can dip into in order to convert it into nitrite and then nitric oxide on demand as needed all the time. And of course, then with our nitrate prebiotic gum, we can also give a little extra nitrate on a day-to-day basis. So we recommend 1 piece of gum 2 times per day, chewing for about 5 to 10 minutes. I like to have my clients chew a piece of gum after they brush their teeth before going to bed. So that way that prebiotic nitrate can hang out in the oral cavity overnight. And then we also have our cognitive support, which we're currently studying in a project right now that can enhance cognitive clarity and executive processing and overall mental health. So certainly making sure that we teach our patients to optimize their nitrate intake. There's a lot of great research coming out that, different layers of research, epidemiological and more mechanistic, looking at the therapeutic capacity of nitrate and looking at the benefits of a nitrate-rich diet on things like longevity and all-cause mortality. So ultimately, being familiar with what foods are going to be rich in that dietary nitrate, our dark green leafy things, our beets, our celery, our spinach, so on and so forth. Now, some individuals might be concerned about oxalates, so maybe they're trying to minimize these foods. And I like to make sure I highlight it every time. If somebody is on a low oxalate diet, I think it is absolutely essential that they supplement with dietary nitrate. If they need to be on a low oxalate diet or they feel they should be on a low oxalate diet, okay, but how are we going to get the dietary nitrate and, some of the other nutrients, vitamin K and folate and other nutrients that they might not be getting from those dark green leafy things that they're avoiding? So we only have 0.7 milligrams of oxalate per 2 capsules. So we made sure to study that. That's a negligible amount of oxalate, which would be, I think it's about 1/25th of a piece of spinach. So a completely negligible amount. And that way we can make sure that those individuals are getting the nitrates that they need for nitric oxide signaling. Carnivores as well, maybe a different topic for a different day, but low oxalates, carnivores, they need to be supplementing with nitrate to fill the nutritional void that their chosen diet is creating. And of course, lifestyle, sunlight, exercise, movement, nasal breathing, breath work, there's stress management. There's so many just natural, holistic lifestyle foundations that can really optimize nitric oxide signaling and production in the body. So you can really help your patients feel better faster by leveraging the healing power of nitric oxide. So that's the More You Know series. I hope you enjoyed this episode. Remember, health goes where blood flows. Follow Berkeley Life for better blood flow tips, science, and education.